MCB9, same gender living LGBTQ task force to order. Is there a motion to adopt the agenda? You must declare it for it to.
Yes. I make a motion, and actually you're a public member, so I guess you can.
Is it motion adopted?
Motion
adopted.
So once it's seconded.
Oh, second.
Okay, very good. Then we are adopting the agenda, which is a brief agenda. And have we a motion to adopt our minutes from September?
With friendly amendments? Yes.
Okay.
I make the motion, we adopt the minutes with friendly amendments.
Seconded.
Would you like to cite such amendments as you?
At this particular time, I would request that they be pending. Further review.
Okay.
I really don't like the period on the end of the sentence. It's
Somebody get the hook. Okay.
I want for a month and what's going on.
All right then. Let's
any proposed agenda items or what's your meeting actually? None? Off you go.
As no one is visiting virtually, Awilda. Hello, Awilda. Awilda Reyes, are you there? Can you hear us?
Hi, yes, I'm here. I'm actually joining in for a school project. Yeah.
Okay.
What's cool?
I'm taking urban sociology, so I'm supposed to join any of my community board meetings and just talk about what I learned there.
Are you a Columbia student?
No, I go to LaGuardia.
Oh,
Okay.
oh,
Yeah.
okay. I went to LaGuardia.
Really?
I did several weeks ago.
Yeah.
Well, welcome, Awilda.
Okay, thank you.
Yes. All right. So last month, we, following our review of our community needs assessment survey, we decided that we would, based on the results, reach out to committees and city agencies to get presentations from them, hopefully, respecting such resources and or services as they provide to our community.
Yeah.
And in the intervening time, I reached out to about a half dozen of those. And as we're attempting to be a resource for an underserved community. So to which did I reach out? I reached out to Department of the Aging and haven't yet to make a connection.
What way?
What way? In what way? By phone.
Yeah, I saw them yesterday.
You did. Yes.
And take them.
I know them.
Milton. How are you?
Could ask on you.
Yeah, I'm attempting to. Milton, can you hear?
Milton, can you hear me? We just go that way.
How are you, Milton?
All right, here we are now. Hold on a second. I'll see if you can see me.
Milton, can you see me?
Milton, I don't take my line. I was thinking of that. I have very limited lines.
I was just filling you in on the accurate melody.
Oh, okay. I see. A little kitschy.
And can I just say, there are so few people who know the score to Yentl.
Yeah, so leave it to Chris.
And Will and Grace, because I'm copying a line from Will and Grace.
Okay.
Yeah, that was good.
So we're just picking up where we left off last month, Milton, in our determination to reach out to city agencies and committees to gauge them about joining us to share presentations on such resources and or services as they might provide to our community. And among the agencies and departments I've reached out to included, I started saying Department for the Aging, with whom I've made no contact yet. Department, DYCD, Department of Youth and Community Development, left a message. I spoke to, who was it? At Health and Hospitals Corporation. Let me find my notes. I spoke to,
Oh, you got
no, bless you, thank you. Oh, those lozenges?
Yes. Yeah, yeah.
I might like one of those, actually. Thank you
I
much.
appreciate you're so quick to say I'm gonna come away. Golden, how are you? You like what?
DYCU office was closed. They said they were open until 5. They were closed at 4. Or there was a message saying they were closed at 4. I spoke to Doug at the Mayor's Office of Special Projects about the Unity Project. And Doug said that he would have the director of that office Jason Littman give a call back. I sent an email request to Health and Hospitals Corporation. I spoke to Noel Alicia there, and he said that they would review the email request that I sent and determine who might from Bellevue come and make a presentation to us at our December 23rd meeting. They have both a Bellevue Public Relations office and a Pride Center office, and said one or the other would likely join us at our December meeting.
Yeah, for the Bellevue High.
Yes.
Great.
Now,
Interesting.
he said also that
I was there with my family, she goes, office about there.
okay. Well, he mentioned also that while he didn't think Harlem Hospital had either a Pride Center, he didn't know if they had a public relations office, but he said that Metropolitan Hospital has both, and that between them, they would coordinate a presentation for us for December 23rd.
Just as a side note, I'm actually on the phone with Harlem Hospital Government and Community Affairs about something else. And I can actually ask this question.
Good.
But the other possibility locally might be Metropolitan.
Yes. Yes.
Yeah.
Right. That was what Doug mentioned.
And just the Department of the Aging, our more natural contact would be the young lady who was here, and I think she's in my phone somewhere.
Okay, great.
Help me with her name, somebody.
You
You know what I'm talking about, right?
No one was saying there.
The one that used to work here prior to Ashley.
yes.
Because I ran into it.
I'm blanking, but
Right.
yes. In fact, that's where she is now. You're right.
Right. Yes.
Good. We have a natural
Connection.
connection. Department for the Aging, I did speak with someone there, and they said all services are available to all communities. And didn't But I posted a presentation request to them as well. But we can, no, I almost had her name. Yes, we can ask her.
Starts with an M, I think, and I can't think of the rest.
Yes. All right, who else?
Brigade,
Say it again.
brigade, are they gonna come?
We will see. We put in a request. Midtown Community Court, they didn't connect with anyone. So those are the ones with whom we have to which we've reached out up to the moment.
So is there a possibility, what is the name of the court? In,
122nd,
yes, it's a community court.
whatever the name,
I think I have
it's
it.
on the east side,
Yes,
like
No.
Third Avenue.
yes. I think I have a contact.
And we talked about the Unity Project. That's a project of the Mayor's Office, Department of Health. I learned.
Community project.
And those are as many contacts as I have made.
Those are great. Let me ask you, do we have a priority list of that, we think are more important than others?
Well, we took a pass at conceiving that last month.
Right.
So we checked off the agencies that we thought.
It was a lot. The ones you got in touch with sound like these would be very essential. And I'm wondering if there are other as essential as those. I mean, certainly those are huge areas of concern.
Mhm. Well, among others, that we broached with each other last month was the Administration for Children's Services, Department of City Planning, Department of Consumer Affairs.
What do we think? I mean, like Chris knew an awful lot about what everybody did. I'm wondering if there are those that really affect our community more than others.
Well, one that I reached out to and spent 20 minutes on hold with was HRA, Human Resources Administration, because I know they have HASA, which is the HIV/AIDS program.
Right.
Or,
126,
on 125th. That's the nearest office.
Yeah.
Yeah, across the street from the state office building,
oh,
I think is where the HRA Harlem office is.
Or SNAP, I think, but I think the other programming comes out of Dykeman.
Is that so?
Yeah, and that's an interesting one. The House of yeah. Oh my God. You know what? I may have a House of contact.
Okay. Oh, that would be wonderful, because
So you think maybe getting up, so I think that's a really interesting way to look at it, and I think that's a good lead in. So the HASA program is a subset of a ton of programming. So maybe we can get the whatever director responsible for the umbrella. That's what you're hoping for.
well, it's Department of Social Services, so it's
Yeah.
it's public assistance for HIV/AIDS impacted community members.
But these programs usually have their own director.
Uh-huh.
Yes, I think finding that person who oversees the umbrella, not all programming, but that's related
like
to.
Harlem United.
Hmm?
Like Harlem United.
Harlem United is a provider, and I think that's about it, right? I don't think they're.
But they're not a city agency.
Right.
They're I think they're a nonprofit.
But
yeah,
I'll give that a shot, because I have a reason I have to make a phone call to I've got his damn title. It's client related, so he might be the perfect guy. Yeah.
You'll reach out?
Mhm.
Splendid, thanks. And who was the other one you said?
The other one was HRA and Harlem Hospital Government and Community Affairs, which is also their PR office.
Would that be HHC?
Yeah, HHC Harlem has their own Government and Community Affairs office. And I think Harlem is definitely bigger than Metropolitan.
Oh, yes.
Yeah. Unless you could, I think those are the two city ones in this area, and then Lincoln might be the Bronx
The
one.
theater?
Yeah,
Well, the first one you had there was, that looks,
Gone.
God.
Oh, downtown is part of Mount Sinai. Do you want Mount Sinai?
Certainly, why not?
Yeah.
I mean,
Good point.
Mount Sinai is a private hospital.
Right, but you know,
Mount Sinai might be is it part of Northwell Health now?
anything's possible, right?
yeah,
So maybe the private should be the second. and
Second
city-
tier.
yeah,
But immediately, as we are something of a city agency
Keep
or
it
an arm of the city, we should
Focus on-
align with,
initially on the city agencies,
Yes.
but
to the extent that this working group serves as something of
conduit.
a watchdog and an advocacy arm of the community board. In fact, yeah, I use
There's
that.
none of town or the Bronx AIDS organization that deal with the city, import, there's none.
You said none in the Bronx?
None of the Bronx, none of town, man.
I don't think there's
Wow.
really AIDS organizations much
I mean,
anymore.
yeah,
Oh, street project, but that's more harm reduction, drug related, I think. And corner project, which is,
in the Bronx,
yeah, that's an interesting question. That's also an interesting perspective, Milton. Which it's, because the landscape has changed over the last 20 years.
Mhm,
So
mhm.
even HASA, I don't think is really the same as it used to be. But it would be great to get a presentation in terms of what services HRA provides under Department of Social Services.
Okay, here's a,
said that the headquarters, 125th, or the headquarters downtown.
HRA.
Yeah,
Well, the headquarters is downtown, but I'm fairly certain that HRA, again, it's a new building directly across the street from.
oh,
The state office.
they moved from the upstairs of that other building. But
Right.
My understanding is,
14th Street.
no, 125th, my understanding was it's primarily SNAP.
yeah,
Oh, here it is, it's with HHC. Noel Alicia, he asked me to send a letter. So this is what, I sent an email, then Noel Alicia is his name. It was good talking to you today. For our conversation, the Manhattan Community Board 9 SGL-LGBTQ Task Force Working Group serves West Harlem as both a watchdog and advocacy arm of the community board to ensure equitable provision of services and resources to our community. Results of our most recent community needs assessment survey indicate that fully half of respondents cite mental health as a prime concern, followed by housing assistance and healthcare access. I'm reaching out to ask if a representative of Bellevue's Public Relations or the Pride Center can share a presentation about such services as you provide to our community at our last meeting of the year on Tuesday, December 23rd at 6:30 p.m. And we left the address. So that's the languaging
Yeah,
that we're using.
Great.
Yeah, okay. Yeah, so we'll see what they come up with. Something else that I wanted you to, did some outreach. Brittany at Brotherhood Sister
she
Soul
just sent me an email.
sent me one too. And
Oh, it's a form email. I can see it.
but yeah, we should be aligning with them.
Absolutely.
Yeah,
Absolutely.
she reached out asking for help with, they have classes,
Yeah.
arts classes.
yeah,
So my theater company is doing an intervention, a theater-based intervention between Black and Brown Youth and Police at April Randolph Campus High School now. So I told her I would let students there know
Okay.
about their program.
When are you doing this?
I'm sorry,
When are you doing this intervention theater piece?
on Wednesday and Thursday mornings, in the government civics class, which is high school seniors. Miss Joe Scriba is the teacher, and he's a great partner. We've been doing it for about a month now, and we're gonna be working with them through December, through
Wow.
a week before Christmas. And we've got police officers from the 26th precinct participating, where it's sort of a conciliation model, an intervention wherein we don't frame it this way. We don't
Yeah.
tell them that this is our intention, but we're attempting to re-socialize the police. To recognize that no matter where they may be from, as they police our communities, they become members of the community and are duty bound to recognize us and our children as fellow community members rather than as perps, you know, and
You know, I mean, before we had centuries, that's never gonna happen. Ken Roosevelt was one in five, you know, what's going on with, you know, become the president. It was, please, not trusted.
well, that's why we're doing this project, because of the mistrust that is well earned. And we started it back in the summer of 21.
And it's supposed to have a gay center there, prison. I heard.
Yeah, there is it's kind of like the domestic violence unit group or dealing with violence crimes, but it's not.
IVP,
Yeah.
intimate violence, intimate partner violence.
Yeah, but it's more of, it's a two-person group that handles the specific issues, but that's about it. They also do domestic violence broadly.
Hmm.
So they get a bit more training, but it doesn't quite work out the way people think. If it's a 911 call, whichever officers are on duty respond. It's up to them to kick it over the fence to that group, perhaps the next day.
But along those lines, you make me think of something, Ramon.
NYPD, One Police Plaza,
Perhaps,
which would be.
They had a
deputy-
gay,
deputy community,
they would have a community assistance gay, Freddie.
So anything like that would be the deputy commissioner of community affairs or services. There's someone specific for that. All of the community affairs officers roll under that deputy commissioner. So that could be a great letter. You might have to get some response.
okay. And I can ask, I just met the new captain at the 26th precinct who started there last Thursday, Captain Zawinski, who's an enthusiastic ally so far.
Yeah, so pose the question. The guiding force may be from Manhattan North, which is 104th or 109th Street. So that's where some of the folks who oversee what happens in northern Manhattan over the precincts, and then they are in contact with 1PP. So you might find he won't make the call, but he might be able to point you in the right direction.
Okay, and something else that I started to say, Ramon, you reminded me of. Again, now, this is veering off a little bit because it's not a city agency, but the Anti-Violence Project. You familiar?
Yeah, I think I've heard of
Yeah, they do a lot of work around intimate partner violence. And we could ask them.
Wow, that's yes, that's God, that sounds also like something we should be involved with.
The violence project.
Yeah, I mean, because there's so many issues that are weird issues in our community that nobody sort of thinks about.
Well,
I mean,
it's-
I think
it's not-
there are a lot of things we can't do. I mean, it's like somebody comes to us and says, I can't find housing. Well, Jesus, who can? But but if they come to us with those particular kind of problems, which are borderline mental health problems, I'm guessing, that would be a very, very valuable contribution for us to make, I think.
You make sense, Milton. Also, because of shame.
Yeah.
And guilt. It's something that we are less disposed towards talking about.
Well,
Absolutely,
remember, this has been front and center in the 2-6 precinct, the couple where he stabbed the partner and killed his partner
Yes,
while on the toilet. That's 2-6.
okay.
So the other possibility could be also housing court, or I have to think about that for a minute. What is the advocacy group for that?
Well, I called the Midtown Court. That was one of the agencies that we had, but wasn't able to. I don't think I made a connection with them.
So the house course downtown.
Yeah.
Oh, yes, I did. They're the ones who said, when I spoke to someone, and said, all services are available to all communities.
Right. So some of that stuff.
So I posted I posted a presentation request.
So some of that stuff comes through guardian ad litem, which is kind of like this interesting group of guys, and I sort of fall in that category where on advocacy, we're responsible for figuring out what are the resources that are needed for the client at the time of eviction. But there's no playbook on it. You pretty much have to have a Rolodex or be resourceful and be able to make phone calls. You just have a level of authority to expedite some stuff. But it's a really damn good question. Like, it doesn't get dished out like, hey, this person's a specialist on that. It's like, this is what the case is about. You figure it out.
Yeah,
That might be an interesting question I have to pose.
and it's
Bias related eviction or housing issues, how are they handled? Let's say bias, neighbors, hostile neighbors, things of that
Yeah.
long, indifferent landlord. How is it? It all comes into the housing court, but you can have a judge can assign a guardian ad litem if he feels that the client is not capable of self-representation or lacks. So in other words, they will say they want you to go to that environment and scope it out and report back to the court. It's an interesting, it's
Yeah.
something I never thought about as a possibility, but yes. Actually, it's worth let me ask in housing court.
okay.
Put that on my list of to-dos.
We're going to be
I
following.
was there was no input, Brian, input there. I was looking at the flyers. I took the phone there. We got there late. There was not enough people there. Only one or two persons. She was the third, and there was no prior information there.
Where?
The housing court?
Yes.
I don't think, well, that would be a bias. So I don't think
There was nothing.
the judge is not going to look at it as something specific. They'll look at it as it's a bias, and that's kind of a broad umbrella. And then he will deal with it as a bias related issue. But it would be interesting to sit down and find out how often it is the case and how does it actually get shepherded through the court. I don't know how people bring that case.
Is it a hate crime or?
It could be a hate crime.
Yeah.
But then the DA's office might step in on it. Right.
Which
You did make a.
would be a happening thing in the universe.
Yeah.
In fact, and we haven't talked
We
about
had
the
a
DAs.
judge-
Yeah, 30.
Well, Attorney General come to come board. Now you wasn't there, but Brian and what's his name?
Alvin Bragg?
Yeah, the king. There was two. There was years ago.
We do have, as a resource, we have the
What's the king?
DA's community person. She's up in
Right.
Washington Heights. She might be a good lead towards.
I'm sorry to tell you
Hmm?
that unfortunately I have a curtain going up.
Oh, break a leg.
Thank you, thank you. Anyway, sorry I have to
That's
leave,
a
but
breaking leg,
We look forward to
the
The
reviews.
positive
Yeah.
reviews.
all right,
Have
well,
fun.
thanks. We'll speak soon. Thanks
All right,
again.
looking forward,
All right.
Milton. Thank you.
All right, bye.
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 We'll sign you in,
Yes,
as having participated virtually.
So not to pivot too much in light of recent news, and maybe this would be a question for Ariasella, but what is kind of the overlap between the kind of major call outs in the survey results? So mental health is a problem, housing assistance, healthcare.
Mhm.
What is the
Healthcare
overlap?
access.
Healthcare access, what is the overlap in terms of food security? And
oh.
second part,
uh,
would there be kind of enough time to, you know, look for resources or
Oh,
kind
food?
of,
Food insecurity.
yeah, going into the holiday season, so that means 2 more
Ooh.
meetings.
So you start interested in food and now I'm going.
I just had asked this question, what were the pantries in the area and.
Yeah,
Um,
I mean, everyone knows of Iris House, I feel like,
I
oh, the
don't,
one on Lennox,
uh,
Lennox.
7,
I know of Iris House.
Yeah.
I don't know Iris. I've heard of Iris. I don't know.
I've been there, but it's really small.
The one in the new building next to McDonald's? Am I?
No, across the street, on like 139,
Yeah.
you know where Make My Cake
Uh-huh.
used to be?
Oh,
It's
yes.
in the block across, so that's one
right.
location.
Strawberries Row.
I know they have another one, I don't know where it is.
So I think they're in the new building across the street, but up on the second floor. They're
Oh.
above the discount. I just passed it the other day and I saw Iris House and I meant to ask somebody what it was all about. I'm not
Yeah.
familiar with it.
I mean, they do like a various amount of services, I think. Their 2 main ones are like LGBTQ community support. And their second one, more popular, is probably food insecurity.
John Martin, that's a phone call for you then, to a director. Cause they might,
Iris House.
yeah,
Iris House,
Mhm.
and it wouldn't surprise me if you know the director.
that came, I heard about it, but I never been there.
I've never
Yeah.
seen it, I didn't know about
And
it.
their focus is on food insecurity
yeah, they do
Okay.
the what is it called?
and food pantry.
The food pantry.
Do they
The food pantry.
do housing at all?
I don't know.
You know,
I mean, if we're talking about private organizations again,
Yeah,
there's Palante. Who's
yeah,
in this neighborhood that does,
Yeah,
housing.
I feel like Palante's got a really long list though.
yeah,
Say it again.
I feel like Palante's got a really long list.
And you know they do.
yeah.
You know
I
they do.
know they do.
As does Met Council,
Yeah,
which deals with northern Manhattan and the Bronx.
So the other group, and I'm not optimistic about them, is NIMIC.
Never heard
Northern,
of it.
NIMIC? Yeah, Northern Manhattan, Northern Manhattan Improvement something, they do housing, advocacy, GED programs, it's a full umbrella, they're up on Audubon.
but you're not optimistic.
Well, yes, I'm just not, I know they show up in court on legal representation, but I don't know if they do housing placement.
Right,
But they may have a sense of what goes on, but you'll need a director.
right.
It's a private,
It's a nonprofit, but they've been around for a minute. They've been around, they've gone through their iterations of madness also.
northern
Similar-
Manhattan.
Yeah, NIMIC, sort of similar to Harlem United,
Yeah,
or they exploded, and
Yeah.
all sorts of things.
Yeah, I mean, Harlem United still has an office on 125th Street.
Yeah.
Do they
are they open?
really exist?
Yeah, right, that's the good question, and I think that ED went down to GMAC or something, he jumped ship.
Yeah,
Or maybe
GMAT?
G,
No, GMAT doesn't exist anymore.
what the dude's name, that's why it's bizarre, yeah,
Oh, okay.
yeah.
Northern Manhattan.
I'm gonna try to look it up as we go.
Okay.
There's seen, the Isabella nursing home.
So, oh, that would be Department for the Aging again. You said you were there today, right?
They were in a state building. Singapore with Sinclair, job search.
Okay,
Was one person that came and had nothing on the table.
do you have a contact?
No, he never had nothing on the.
Okay, all right. It's different. Oh, but we were saying, oh, who did? Ashley replace? I'm just,
Oh, I don't know.
Low, it's N. You might have saw it sticking in my head now for another reason, it's an M.
yeah,
But I actually ran into.
Mona,
No,
Myrna,
it's not from Myrna.
Myrtle,
So,
Myrtle.
yeah, so NIMIC is NMIC, Northern Manhattan Improvement Corporation. And brief description, NIMIC is a nonprofit that operates under a settlement house model to provide free services to residents of Upper Manhattan and the Bronx. What is a settlement? I know there's a lot of this kind of settlement. What is a settlement model?
Well, so, I know among the, services settlement houses have traditionally provided, have included, shelter. Or food and shelter,
Okay.
and you just made me think of Goddard, Riverside.
Boom.
Oh, yeah.
They don't do nothing with gay people, and they are into
Well,
different locations and you know where.
so NIMIC is, they have legal assistance, I know that for a fact. Housing assistance, I know that for a fact. Employment and job training, that is true. Education and career service, benefits and finance, health and social service, domestic violence intervention, and weatherization.
Legal housing assistance, what did you say after housing?
Legal housing assistance, so the health and social, employment and job training. They have GED programs, which actually is sort of reasonably well regarded. Education and career services, benefits and finance.
Yeah, that sounds like the services that Goddard Riverside.
Yeah, it sounds
Which
like,
is a settlement model organization also.
but then to your point, that's worth a call to Goddard, yeah.
Yeah, and we have a contact. Chad Franklin
Okay,
is, you know, a friend and partner. He's a board member of the Gatekeepers Collective organization, and he's participated frequently,
Mhm.
albeit virtually.
right. Yeah, I think I've heard that name before, right?
Okay, yeah, so to your point, we'll say, what are you doing for the?
Yeah. To your question with that, did we talk about this, like when you look at all of the data, what were the priorities?
Actually, who did you replace? Who did you
Who's the
replace?
person? I can't think of her name.
Who did you replace?
That was here before.
Oh, Madison.
That, it was an F. Yes, yes.
Well, Blackie, because we were traumatized when she left. Oh, well, no, we were delighted when you came.
Oh, okay.
Oh, do you remember Madison's last name? Yeah, she might be under my phone under that.
Yeah.
Cause she's with the Department of the, she's still with the Department of the Aging?
Yeah.
Yeah.
Thank you. All right, thank you. Oh, this is good. Yes, Madison, I lied.
Yeah.
Do I have to here?
And her attitude was call me if you have any questions for this.
Right.
Right, so.
You going to call her?
I give her a buzz or, yeah.
You have a phone number?
That's why that's why I asked for her last name. Let me see if I have her in my phone. I
Mhm.
ran into her at a DIFTA hearing.
When you were on the phone with these, not the city and state ones, but like the HRA,
Mhm.
SSA, did they give, I mean, that would have been some creative foresight, did they give any kind of inclination of what their activity level would be post or during shutdown, during
No,
withholding of funds, was that?
well, there, in the recorded message from HRA, where I was on hold for 20 minutes. They had said repeatedly, the loop said that SNAP benefits would be late this month. They didn't say that they would be not be forthcoming,
Right,
but they mentioned that, you know, SNAP benefits will likely be late
yeah,
this month coming. But other than that, HHC, neither
Yeah,
HHC,
Columbia University has a big group of students. But other than other groups there,
Mhm.
I attended a first meeting of big students. Columbia inside.
Actually, that's a thought also.
What was it?
Ramon says, Columbia has gay students groups. I mean, that's another tier or level of
Yeah.
engagement that
Under,
we can take up.
yeah, under strategic planning, I'll be meeting with the Government Community Affairs Group, BB,
Okay.
which is Director of Community
Finish
Programs.
Arnold.
BB Sade
Arnold,
Arnold, yes. So do you speak with her or?
yeah. I almost had a falling out with her.
So, okay. I'll
No,
speak with
she's
her.
lovely.
Yeah, so I have a meeting request coming up and that could be one of the topics of discussion.
Okay, great.
Yeah.
Great.
So there's definitely faculty-led, grad student-led, and student undergrad-led programs. So I wonder if there is an overarching something, arching something that would be useful to act as a focal point, to your point. I don't know if it's gonna come through government and community affairs or,
Well, you're talking about in terms of an appeal to them to
yeah, I think,
share with us
I think they're gonna be a little bit
such
more.
resources.
I
they
think,
might-
yeah, I think they'll be a little bit more complicated because they're just so many kind of arms. Based on stuff I've seen on campus with them. They
Yeah,
have tons
so
of
many tentacles they have out
Yeah.
to the community. And also this in
internal.
terms of some,
internal.
where I said, I almost had a falling out with Phoebe. It was not her, the faux pas was on my part. I didn't
Trying to
finish
navigate the
the
landscape.
the in-kind space
yeah,
access. I had done an application, which they had acknowledged, but then I failed to follow through in securing the space.
Oh, in the infamous short 1 week period of time, you have to do everything before it blows up, yeah,
So in any event, but she was as helpful as she could be.
okay.
So, yes, and
Okay.
she's my sense with respect to Columbia folk, Lofton Flowers and several of the people I was dealing with when we were working on the community benefits agreement are not even there anymore. But of the people we have access to, Phoebe is one who I feel is actually invested in community.
Well,
Yeah.
so just as an aside, were you on the board when the CBA was negotiated?
I was on the board, I was the Arts and Culture Chair of the board of the West Harlem Local Development Corporation, which seated the West Harlem Development Corp.
Okay, brilliant. So I may follow up with you to have a conversation about the CBA.
Okay.
Okay, I didn't realize that. You go back a bit.
I
2007, 2006, 2005.
2006.
This
is
is
when
what day over 10.
I headed the working group that and convened and guided the working group that crafted the
Arts and culture.
arts and culture section of the document, yeah,
Last
of the
piece,
CBA.
last piece to the aside. How many of the chairs, similar to the role you placed at the time, are still,
Marita Dunn,
of course,
Ted Kovala,
okay, two.
I think Cecil Corbin Mark is dead, he was WEAT.
Oh, something, yeah, we had.
Pat Jones, God bless her soul, she's also no longer with us. She was actually a community board 9 chair at one point, like Marita had.
And you know, both Pat and Cecil are right. They're my
Corey
street,
McClear
my street is right next-
represented both councilman and then Senator Perkins on the board of the West Harlem Local Development Corp. Juan Rosa, but he's not on community board now. So yeah, but I think Ted, Marita and I are the only ones who are board members still.
And what about this guy, John Baptista?
John Baptiste, I don't know him.
Okay,
In passing, but yeah, no, I don't know him.
brilliant. Thank you very much.
Yeah.
Okay,
Yeah.
I would come to you anyway at some point within the next couple of weeks as I figure this out.
To push me around now.
Did you meet
Don't do that.
Flores Forbes and Maxine?
Oh, sure.
Okay,
In fact, Flores Forbes, yes. Yeah, they were, Flores was quiet most of the time. But yeah.
okay.
But Maxine was,
EVP.
yes, and she was one of the people with whom we interfaced regularly in the CBA negotiation.
Got it.
Yeah.
Brilliant.
Maxine Griffith, yeah.
She's down in Trinity, so I'm trying to drop in on it.
Like I said, no longer there.
Right.
And Flores isn't either. He was, yeah.
I think he might be at law now.
Oh, okay.
And Maxine's down in Trinity, Wall Street.
Okay. Yeah,
I have my spies out there working it.
sounds like you.
One must do the best.
I think we need more clinic, especially for gay people uptown
Staging.
Clinic?
or hospital.
Okay.
Oh, okay.
Well, so. What about, you must know the guy, I met him, not Dr. Bell, but. There was a guy who had a clinic on 125th, he was affiliated with, Columbia. I want to say his last name starts with an A. Oh, man,
Madison Ayala.
yeah. It's gonna have to be probably Columbia or Mount Sinai. This seems to, it's so resource intensive that no small group seems to do well. Even if they start a clinic, it has to be in affiliation with something like Columbia or Mount Sinai.
Roosevelt Hospital on Columbia.
Mount Sinai,
It was Mount Sinai.
yeah. And actually, their infectious disease group is kind of well regarded from what I understand.
Mm-hmm.
Which is the HIV group now is essentially,
Aha,
yeah, it's no
Right,
longer,
right.
there's no longer an AIDS ward, everything falls under.
Yes.
But I'm up uptown, familiar with Bronx and Blackman area, that was.
Montefiore, yeah.
Montefiore would be that, yeah. And Lincoln is HHC, but the Bronx actually has a higher HIV new infection rate than higher rate than anyone else.
Yeah, incidence
Yeah,
rate.
yeah. Of new infection,
So that's our prevalence rates.
yes, is, yeah. So this kind of goes back to, maybe there's also an HHC group that monitors the data and looks at the data.
Mhm.
I wonder if
That's what we need.
they might be useful for from an informational point of view. Yeah, I used to receive their surveillance report monthly, but it's like,
I never did.
yeah, it's a chunk to read. And that group comes out of Long Island City, as I recall.
I've been there, and there was no
Nothing useful,
damage like Times Square,
like,
only the dog.
I don't quite get the analogy.
I was there, there was no input, any service, there was no groups, game was done there.
Uh-huh.
But when you saw the dog, still were no game.
These specific services. Got you. And which is why you're saying,
Yeah.
we need
Yeah.
site specific services for,
Right,
yeah, okay. You make sense when you make sense. And that's, no, yeah.
Yeah,
That's along the lines that you were talking about in
Yeah.
terms of where is the overlap or
Yeah.
with respect to the results of our survey.
Yeah.
Our needs survey.
Yeah.
so Are you familiar with Dr. Bell?
I'm not.
He is, I want to call him like director or senior director of the Young Men's Health Center at Columbia. I know this is recorded, and if he has an opportunity, he is like incredibly well regarded by most of the folks that he has as patients. He might be an interesting person to even just chat with, to get an understanding of what the needs are. Is he also, as I understand,
At Columbia
yeah,
Presbyterian?
he's up at Presbyterian, but his facility apparently is on Audubon. But it has a cutoff age of like 25 or something.
Okay,
Okay, but that's a decent catchment.
yeah,
That's a good catch, by the way. Yeah,
since the community needs was meant to target a
Yeah.
younger demographic anyway.
and I don't
Okay.
know.
That's pretty good.
Yeah.
We'll take 18 to 20. Is it 18 to 25?
I think
I would
it
think.
is. Because I'm gonna suspect it correlates with insurance, right? And then
Yeah.
there's probably a drop off at 26, right, under Medicaid or Medicare.
And there you go, and there again, you're reminding me about HACA. I think you have to be at least 18. And God bless you,
Thanks.
to be able to access,
Because you would be a
because
minor,
that's Medicaid.
well, you would also be a minor, which is problematic, because as a minor, you might fall under CPS, Child Protective Service,
At 18?
below 18.
Oh, well, no, below 18,
Yeah,
certainly.
yeah.
But I think, but when you're talking
Oh,
about,
CHIP,
that's children's
Yeah.
health.
yeah, so CHIP might go up to, interesting point, CHIP might go up to 18, 19,
Mhm.
which is an easier program for qualification, but once you hit 19, there's a drop off.
Also, CHIP is for young people who are living with their parents.
Is it?
I believe so. Homeless and runaway youth
Yeah.
don't access CHIP.
I was in a state meeting, we were talking health. Everyone mentioned Department of Health across the street over there, they were not talking about health in Thailand in the city. There was me and JJ and what's his name, Earl, and there was someone else. There was, not I met, but they were talking health, but they were not talking about giving health centers.
So
Okay,
I have the Young Men's Clinic, it's 21 Audubon Avenue, first floor. Practice specialties, adolescents and adults, age 14 to 35.
so
Okay, that makes sense.
at age 14
Yes,
to,
yeah, and these are some of the bullet points: condoms, confidential teen services, health, education, counseling and workshops, HIV prevention, PEP/PrEP, mental health services, physical exams, rapid HIV testing, social work services, that's kind of interesting, right? STD testing and treatment, including treatment for partners.
see, that sounds wonderful. Along the lines that you're talking about.
Yeah.
It's Community Board 12.
Yeah.
So
Yes.
I wonder, yes, so I wonder, to your point, if that's a discussion with that group to try to figure out how to establish one in 9.
Yeah.
Right.
Like I actually had,
You have a phone number for Dr. Bell? You have everybody's phone number.
if I can't get it.
Relationship with Dr. Bell?
I believe I met with Dr. Bell.
See,
Mm-hmm.
Believe I did, and if I didn't, I know why I would have. I may have spoken with him. I'll get it. He actually lives in around 160 something street. Dr. Bell.
so he can walk to work.
Yes. Dr. Bell. Or I have his email and phone. You want to make the call?
I will.
Okay.
I'll tell him. Chris Johnson told me. to
Yeah.
call.
I think I forgot what the issue was.
And he'll say, "Oh, Chris, of course."
Yeah. Yeah, and it's the other guy, you might know the guy on 125th. There was a facility on 125th, and I can't think of the guy. He was a doctor, and I thought he was affiliated with Columbia, who also had a clinic. But Bell is like the guy, and having something in mind would be awesome.
Yeah.
But I also believe the counterpart, I don't know
Yeah.
if that would be an OBGYN facility or a young
It would be.
women's. Yeah, I'm not sure how that operates, and
Be a little harder, I would say. Not, it's the same amount of resources, but in the court of public opinion,
not needed.
no, it's not that it's not needed, it's not necessarily welcomed or a trustworthy service per
Not
se.
prioritized.
Not prioritized in general, but also I feel like Black women aligned people are not super friendly with women's services in general.
What? Okay, kind of clarify the statement. Where's the bias or where's the?
Bias is in, you know, experimental projects or sterilization, stuff like that is. It's a lot of the distrust with Planned Parenthood, yeah.
What's it called?
Iatrophobia.
Iatrophobia? Oh,
Iatrophobia
iatrophobia. So this goes under Tuskegee also, right?
Yes.
is among the myriad,
Henrietta Lacks
right?
more so, and the experience that happened with Puerto Rican women in like the 70s or 80s. That's like, those are the big kind of points. That's why a lot of Black women today are not necessarily fans of Planned Parenthood.
Well,
Just
just
like it's not, yeah,
you know, I mean, this goes back to scientific racism
Right.
yeah,
and the history
yeah,
of
Experimental.
of tortures
yeah,
that were classified as experimentation
yeah.
on African Americans. Yeah.
Still a much needed service, especially with PCOS and endometriosis and a lot of those that we don't really know about or is not about or researched that disproportionately affect women of color,
Yeah.
especially Black women.
Just,
So
just as an aside, so is there a high incidence of untreated cases?
yeah,
Okay.
For that very reason.
So,
Yeah.
yeah.
Mhm.
like the bias, you go to the doctor and they may say, I'm in so much pain, they ask.
Here's
Have
a
you
ton
tried
of
losing
them.
weight?
Here's a ton of them.
No, I haven't tried losing weight, those are the two big ones.
So what's her name? The gay comedian, African American.
Wanda Sykes?
Wanda Sykes has a joke. She said,
So funny.
she made a joke. So she had double mastectomy,
Hmm.
yeah, breast cancer, and following her double mastectomy, you know, she was crying out in pain, and she said they gave her a Tylenol.
It's not funny, it's true, unfortunately.
And she's Wanda Sykes.
Yeah,
Yes, she has access to healthcare and.
Most definitely.
And money, so you would tend to think, right? Okay, so I think a conversation with Bell or somebody from that facility, because they should also have a better insight.
To
Yeah.
Roland's point about how might we go about duplicating their facility and services
yeah,
here in CB9.
So, moving back to a slightly different issue, could there be an overlap into strategic planning in the CBA? Because there's a provision in the CBA for health services, and that could fall under sort of in kind, not cheap, but you know, to get the ball rolling in some way, shape, or form. I'm pretty sure it's worth it.
And then we need more female doctors dealing with female.
yeah.
Yeah.
I think, yeah, and doctors of any gender, honestly, I
Okay,
think both
okay.
are well received.
And how did you characterize it, Chris, an overlap respecting
Strategic planning?
Yeah, so strategic planning is looking at the CBA and
Remind me what CBA is?
community benefits agreement.
Yeah,
And which commitments have been met, what are the status of the commitments?
yeah,
And I would strongly imagine this is a bucket that has not been touched.
yeah,
So that could be an interesting conversation, and in view of, Heritage, which is really not to be a strong player in this, it would be a Columbia, so even if it's young men's and some version of a young women's,
Yeah.
whatever that would be, I think that would be kind of neat and novel, and,
Young women's health.
young
Yeah.
men, and so young men, young women, LGBTQA.
That was our hoping.
Love.
you love cameras?
Yeah, but no, I'm not gonna.
Oh, man, so Dr. William Bell, Dr. David
That's
Bell. Dr. David Bell has departed,
David Bell.
he has departed.
Oh, after all that,
He is now the director of Lawrenceville.
that's upstate, is that Westchester?
Um, that doesn't stop a phone call because he
Yeah,
would be insightful. Lawrence and um. It's New England, but what is Lawrenceville?
New England.
It's Kentucky. What's Lawrenceville? Is it?
I'll get my steps in.
for your boots on.
Transportation. Does it resonate with anyone, Lawrenceville?
No, I'm not familiar with that area, I'm more familiar with the Bronx area.
All right. Is there any other old business?
I mean, I would know.
Are you going to another movie?
Going where?
They're going to show another movie.
Another movie? Oh, well, hopefully I'll be in another movie. Any other new business?
No, David Bell.
Any questions from our student who is with us today?
Or will that? Any questions?
Hello.
Yeah, we're here.
Hi. No questions, but thank you so much for letting me join in. It's been very informative.
Of course.
Thank you for joining us.
Can you ask her if she agree with the clinic for young people? Can you ask her?
No,
Good
it's
question. Oh, will that? A question for you. Someone asks, what you think of the idea of, us petitioning for
Yeah,
a clinic for young women in Community Board 9.
I think that's a great idea. I think, especially because of everything that's going on in the government, women's health is really important to focus on.
and even if it's not direct health, but health education, that is also sorely needed.
Yes,
You're definitely right about that.
Yeah, and even the idea and the effort of it will make women in the community feel seen and heard, like there is
Yeah.
support around.
thank you.
Good thinking. Thank you, Awilda.
Thank you.
All right then.
Lawrenceville is a private school, Lawrenceville School.
Is it in Connecticut?
It's in New Jersey, near Princeton.
Lawrenceville.
What is it, the school nurse?
They made it New Jersey?
My nephew went to a school in central, is it New Jersey or Pennsylvania?
The Lawrenceville School is a well-known feeder school for Princeton University and has a blah, blah, blah. That makes sense to you?
Okay.
Okay. So,
Did he move over there?
yeah, there was some. That's one of the last things I had heard. He kind of took a break in Columbia when she had cancer, so maybe he affected some change, but it could be a worthwhile phone call.
All right, if you have the number, say, I'll just call Lawrenceville.
Actually, I was thinking just call Lawrenceville or just do a different department. And then you would just call us Dr. So Dr. So we can chat with you.
Right.
Alright,
And actually, he would have a strong sense of need. Also, there's probably a new director who might have a sense.
Yeah,
yeah, Young Men's Health Clinic.
Yeah, so that's been on, that's the one thing I thought should have been replicated in this area with the
Mhm.
young men's health. So most folks will go from here up to there.
yeah,
There's some catchment area issues also.
yeah.
And there's a mental health program that is well regarded up there that comes out of Columbia.
All right then,
Alrighty then,
if there are no, is no other new business.
we move to adjourn.
All right, we are adjourning at 7:36 P.M. Let's see,
What's
I'm hitting M here, yeah.
he's, yeah,